men are at risk for prostate cancer. Actually, the prostate cancer incidence in this country is pretty high. 1 in 6 men over their lifetime can develop prostate cancer. People at higher risk are the people that have family history of prostate cancer, where have a brother or father or uncle, grandfather had prostate cancer. They have a much higher chance of getting prostate cancer. Mainly family history is the main risk factor for prostate cancer. Lifestyle, behavioral things, sometimes it's hard to quantify, but people believe that dietary issues might be a contributing factor. People that are overweight might be a high risk in general for cancer. When prostate cancer is at an early stage, it's not really having any symptoms. Usually when it's really late stage, when they start having symptoms, when they spread to the bones, when they're causing blockage in the urinary tract or blockage in the kidneys, then that's when they develop symptoms. So at early stage, most men don't have any symptoms of prostate cancer. There are screening tests for prostate cancer, and I generally recommend starting at 40 years of age, get your first PSA done, and also get your prostate examined. So if PSA is abnormal or the prostate examination is abnormal, then it needs to be looked at, because that might be a sign of prostate cancer. Usually what happens is that you will need some sort of screening test to detect it. Most people, when they find out that prostate cancer happens at a stage when they don't have any symptoms. So usually detected by elevation of the PSA. The PSA might be elevated more than normal, or PSA might be rising faster than what you normally run at. Say, for example, if it's running at 1 last year and this year is 3, that's a big rise. That might be a concern for prostate cancer. There's also, if the PSA is above a certain level, that also makes us more concerned about possibility of having prostate cancer. And the other thing that we sometimes detect is an exam on the prostate. If you're having a lump on the prostate on examination, that's usually also a concern for possible prostate cancer. When you have either an abnormal prostate examination or an abnormal PSA, then we usually proceed with a biopsy of the prostate. Biopsy of prostate is how we actually find out you have your cancer or not. There are different stages of prostate cancer. So if prostate cancer discovered early, then the common treatments will be the surgery, radiation, or radioactive seed implant. So there are different types of treatment options for localized prostate cancer when the cancer is only in the prostate. If the cancer already metastasized, spread, then you would have to treat systemically, treat the whole body with frequently as a first line of treatment is hormonal therapy. Well, fortunately, prostate cancer is usually found when men are relatively older, and it's very uncommon for men with prostate cancer when they're actually younger than 30 years old or 40 years old. So most men, mostly when they find a prostate cancer, they're hopefully done having kids. So yes, after treatment for prostate cancer, we don't expect you to have children afterwards, because the prostate is what makes the semen. Once the prostate is gone, you won't be able to make any semen, and the sperms that are made in the testicles, they won't be able to come through to the semen also after surgery or even radiation therapy. Now, there are other ways you can get babies out of a man. It's sometimes you can still get sperms extracted from the testicles, but usually most men after treatment with prostate cancer are not expected to have children. For early stage prostate cancer, when the cancer is only limited to the prostate, when the cancer hasn't already spread, then theoretically by taking out the whole prostate, it should give you a cure if it had not gotten out of the prostate. So radical prostatectomy just means taking out the whole prostate. Well, traditionally, prostate surgery for prostate cancer is actually a big incision from the belly button to the pubic bone area. So it's a big long incision. You go in there, basically open the bladder, take out the whole prostate, and then you have to connect the bladder back to the urethra, and it often open where you get cut open for the procedure. There's a newer way of doing it, actually becoming most common way of taking out prostate for prostate cancer now is with the robot. And it's actually a laparoscopic procedure. We make small puncture holes in the abdomen, and we use a advanced instrument, which is a robotic instrument, very, very small instrument that go in there and able to do the same surgery that open surgery will accomplish and do it laparoscopically. So it's much smaller incisions, quicker recovery, much less blood loss, shorter hospital stay, and the usual benefits that applies for minimally invasive procedure, laparoscopic procedure applies for this type of surgery. So generally, it's a better way to go. There are a few things we know for sure. For example, much less pain because you don't get a big cut, you get smaller openings. Much less bleeding because when we do the procedure, we pressurize the abdomen and it stops all of those veins from bleeding. So transfusion rate from the surgery is much less. And the other thing we know for sure is that shorter hospital stay. When you have less pain, quicker recovery, you're able to go home sooner. And the other thing we know is that the catheter can stay much shorter amount of time. With the open surgery, it can sometimes stay for 2 weeks and sometimes even longer. But with the robotic surgery, we typically leave that for about a week or so. So the amount of time the catheter needs to stay in there for it to heal is shorter because healing happens faster. These are all kind of established, we know for sure. And there are other things that we know that probably helps is that because you can see better, so it perhaps can save the nerves better, so it will help with lowering the side effect that can happen with surgery with the incontinence and the erectile dysfunctions. And whether or not the cancer can be better controlled, they actually should be the similar type of surgery of the open surgery, so it's very similar in terms of how it's taken out. So in terms of benefit and getting rid of cancer should be very comparable to the open surgery. Yes, so this all surgery actually these days we do, it doesn't matter if it's open or with the robot, it's called nerve-sparing radical prostatectomy. In the old days, back when we actually understand the anatomy, the prostate is taken out with the nerves around it. The nerves would give people erections. So now we know what the nerves are, we're actually able to separate the nerve from the prostate. And theoretically, with the robotic surgery, it can have a much better visualization, so you can see those nerves hopefully better, and able to peel them off the prostate and save those nerves. Hopefully, the erections after surgery can be preserved. Now, it's not uncommon after surgery that erections will not work as well for a little while. And in fact, people have erectile dysfunction for the first year to 2 years after surgery. It's not uncommon because those nerve endings, they're kind of finicky. They don't like to be pulled around and stretched. Even by pulling them away from the prostate, they get beat up. They don't work for a while. So it takes about a year to 2 years for it to come back. There has been studies that show that sparing the nerves can help the urine control as well. As you know, the urine control is one of the issues that can happen with surgery because we're actually rearranging the urinary tract, so to speak. And it is possible to have incontinence after surgery. Fortunately, most people with the robotic surgery, for example, by about a year's time, the urine control comes back close to what they had before. We also believe that by saving those nerves frequently can help with the urine control as well. But it does take time to get back to normal. It frequently takes about a year. Most people are gonna be wearing a pad or diaper in the first few months. And it takes about a year for it to get back to close to normal. But fortunately, with the robotic surgery, 95% of people by about a year's time, they're pretty good. If you ask them, they're pretty happy with their urine control. But 5% can have long-term urine control issues, even beyond the 1 year recovery time. But I usually tell patients to be patient. It does take sometimes 6 months to a year for the urine control to come back. Now, people that are younger, people that have a no baseline trouble with the urine to begin with, or a smaller prostate, no diabetes, not overweight, those people tend to do better in general too. So those people might have a quicker recovery and a better chance of recovering also. Of course, there are things we can do to help with the urine control to come back hopefully sooner and comes back at all, is to sometimes do KEGEL exercises. Those muscles that control the urine are actually in front of the prostate, Once the prostate is gone, the muscle that's holding the urine has sort of on vacation for previously, had not had to work for a long time. So when the prostate is gone, these muscles are going to take some time to get back to normal, and it takes a while to build those muscles back up. So KEGEL exercise, basically you work those muscles and build it back up, and to hopefully it will hold the urine in for you. Of course, there are different ways to restore urine control. So unfortunately, some people, with the open surgery or the robotic surgery, can develop long-term urine control issues. In those patients, there are different options to get the urine control back, and depending how severe it is, that there's a sling procedure. There's also an artificial sphincter. So the urine control can be corrected if it happens that they don't regain their control back to their normal status after surgery. After surgery or after any kind of treatment for prostate cancer, usually you still have to follow the PSA. And because we know the prostate cancer is slow-growing cancer, sometimes you don't know right away it's going to come back or not. So sometimes follow-up is really supposed to be a lifelong kind of follow-up. You still need your PSA checked. Fortunately, after treatment like prostate surgery, the PSA should go down to 0. There should be almost no PSA being made in your body, and that's a good way to keep track of the prostate cancer. If it comes back, the PSA start rising again, and in those cases, we'll first do two things. One is to find out where it is. If it's in the area around the prostate, or it's actually outside the prostate somewhere further. So we have to look at the pathology of the surgery. If the surgery comes out showing everything's contained, it's less likely to be around where the prostate is. With the pathology from the surgery test, there's cancer around the edge of the prostate, or around close to the edge of the prostate, or actually sometimes gotten out of the prostate, then those people may have much higher chance of cancer coming back around the prostate area. And also going to do some other tests like bone scan, CAT scan, make sure there's nothing obviously on the outside. If it looks like there's nothing on the outside and things presumably around the area where the prostate used to be, then you can get radiation treatment to the area to hopefully help take care of a recurrence in the local area. But if the cancer is outside the prostate, then in that case radiation wouldn't help. In that case, you might have to consider systemic treatment like hormonal therapy for that. So usually what happens is about a week before the surgery, you'll get a physical examination, and you come in and get a full physical, make sure there's nothing else going on. For example, having a pneumonia before surgery is not good, so you're going to get an evaluation first about a week before the surgery. And also go to the hospital, get an EKG done, get some blood works done. About a day before the surgery, you're going to get a bowel prep to clean out your colon and rectum, so that it avoids a lot of stool right behind where the prostate is, because sometimes, occasionally, once in a great while, that can affect the surgery. So in the later surgery, you come to the hospital for the surgery. The surgery usually takes about 2 hours for the surgery to take out the prostate. Probably about another hour to set things up, give you anesthetics and wake you up and all that. So probably expect to be in the room about 3 to 4 hours. Depending also the patient's size, sometimes a bigger patient may take a little longer. People have previous surgeries, sometimes surgery may take a little longer. But usually about 3 to 4 hours in the room, and then you're going to stay in the hospital overnight. You go home the next day with the catheter. The catheter stays for about a week usually, and that's usually what happens 95% of the time. Well, as with most surgeries, you want to take it easy for at least about a month or so, because we do enter your abdomen. Those wound has to heal. If you lift something heavy and do something strenuous, it can potentially cause that to open up and give you a hernia. So generally, we recommend no heavy duty activities for at least a month. So no lifting or pulling anything more than 5 pounds. And no exercise of any kind for at least a month or so. But having said that, though, most people feel pretty good, and it's important to get them move around, because certain activity is good because it prevents other complications. People sometimes mistaken for the fact that they have to stay in bed after surgery, don't move around. That's actually wrong. Get them move around and walk around, walking around the house, doing stuff, and kind of walking around the block, even going out shopping in the grocery store. It's probably okay. The only thing is don't pull and lift anything more than 5 pounds.